For this subtopic 3, what we are focusing is more about the application of what's the finding. What would be the key messages is trying to highlight in this particular module, as well as what are some evidences available or studies conducted out there that can be used for the students to understand how public health nutrition can actually help for prevention of other non-communicable diseases. Performance for those who are working with public health dietitians or nutritionists requires a specific set of knowledge and skill-based competencies to implement all stages of public health nutrition cycle. There are few published findings that is available to be shared. For example, in this slide, a longitudinal cohort study of adolescent school children attending 15 public secondary schools was conducted. This is in fact the first cohort study being conducted in Malaysia for school children or adolescents. The 15 schools that been chosen were selected from 3 different states from the Peninsular Malaysia, namely called Perak, Selangor, as well as Wilayah Persekutuan. In this particular study, the data that been collected are the socio-economic, lifestyle, which includes smoking, physical activity assessment, their fitness assessment, including the 7 days diet histories, and few other informations that were collected in this study, including environmental information, anthropometric measurements such as their weight, their height, as well as their blood pressure, hand grip strength, body fatness, and also their bone mineral density. The blood samples taken from this study is actually the fasting blood glucose and also lipid profiles, full blood count, renal profile, as well as the bone profile and serum vitamin D. This cohort of adolescents will be followed up at the age of 15 when they are in their secondary Form 3, as well as 17 when they are secondary Form 5, and possibly 10 years after their Form 5, which is at the age of 27 years old. It appears from this baseline data that been collected, 9% of the adolescents were obese. Adolescent male had higher fasting blood glucose in comparison with their female counterpart. Female adolescent had lower HDL cholesterol and higher of the LDL cholesterol. It is noted adolescents from the rural area are at greater risk of developing non-communicable diseases compared to their urban counterpart if the trend of their biochemistry profile remain the same. It is crucial to make public health intervention that are tailor-made to minimize the gap between the adolescents who are living in urban as well as in rural. As from current findings, it shows the rural are the ones who are experiencing problem in comparison to their urban counterpart. Another study also shown that the awareness of colorectal cancer in the rural population of Malaysia is very low. In this particular study, the study was conducted among the adults in Perak. Knowing this problem, health education campaign is needed to minimize the burden of this disease in the future. Most of the respondents are still not aware the risk factors of colorectal cancer includes low intake of fruits and vegetables, low fiber diet, alcohol consumption, high intake of red and processed meat, and also low physical activity. So as an overall, The conclusion from both studies that have been shown, it shows how important to understand and few things that should be addressed, such as whether it is required for a particular group for better healthy living and healthy diet and healthy physical activity should be incorporated in the public. So hence, that's the reason why this module is crucial. What this module will offer is basically to understand and what are the missing links and how can we approach or how can we do something about it. Most of the example I'm using here just now is about obesity as well as the adolescent health and cancer. These are few of the non-communicable diseases that is very common not only in developed countries as well as in developing countries. So, in a nutshell, this public health nutrition module will give a good introduction as part of the module in Masters in Public Health. Thank you.